everyone, and welcome to Chat with Nene Alice. If this is your first time tuning in to Chat with Nene Alice, don't forget to like, don't forget to subscribe, and don't forget to send in your comments, because together we can all improve on this channel. Viewers, also, we want to wish you a very, very happy and prosperous 2022. And I also want to let you know that Sierra Leone will be taking part in the Africa Cup of Nations. And as a proud football fan, I am rooting for my country all the way. So congratulations, Leone Stars, and bring the cup home. We are rooting for you and we love you. Okay, so today I have with me Mrs. Isatta Sisay-Jalloh. Isatta is here on the vacation, but she is a medical practitioner and she has been working in the area of palliative care over the years. And so I have the pleasure, first of all, to welcome you to Sierra Leone and to welcome you to Chat with Nene Alice.
Thank you.
You want to say a few words and introduce yourself to the viewers?
Hello, viewers all over the world. My name is Mrs. Isatta Sisay-Jalloh. I'm a healthcare professional by background. I specialize in oncology, which is cancer care, as well as palliative care and various other sorts of things. I'm a community person. I lead on various projects within the community, especially in the diaspora where I live. So thank you for having me, Nene.
Thank you. I have the pleasure to have you in my studio today, and I know we're going to talk a lot of things, that will bring hope, and reassure people, particularly people who are dying of cancer or are dying of, terminal diseases. So first of all, let me just ask you, what exactly is palliative care?
Well, palliative care itself is a word just like any other word you find in a dictionary. Palliative care means palliation. It means you palliate, which then means you soften. You're making somebody comfortable. That's what palliative care means, really. It's about comfort.
Okay, so does palliative care means dying?
Not necessarily so. Palliative care is really around the remit of people who have life-threatening or life-limiting illness. So it's not necessarily just cancer. You could be suffering from dementia and you need some form of palliation. You could be suffering from other neurological disorders such as Parkinson's disease, motor neuron disease, Huntington's, and you need some palliation. So it doesn't necessarily mean dying, but it just means you have a life-limiting or life-threatening illness that requires some form of palliation, in the sense you have some symptoms that you need to be treated so that you'd be a bit more comfortable and you can get a better quality of life.
Okay, so let's come home, because most of the cases that we're having, particularly with our old people, have to do with some of the things you have just mentioned. Do you want to share an example of some of the work you're doing in Sierra Leone?
Well, since 2019, I've gotten heavily involved in cancer care and palliative care in Sierra Leone, trying to raise awareness, because we believe early detection saves lives. But at the same time, during this journey, I also realized we needed somewhere comfortable and conducive for the patients who have been diagnosed, where they could be treated and supported. And I identified Ward 2 at Connaught Hospital. And so I adopted that ward. This October, my husband and team came after doing a 18 months fundraising exercise. We were able to come and refurbish the ward completely and raise it to a Western standard, and also create a small chemo unit where people can receive chemotherapy for day services. So that's what I'm doing right now in Sierra Leone. I'm also a Corona FET ambassador. I work with NACOVAG, and we are trying to see how best we can support, raise awareness, and encourage people to do the right thing with reference to this coronavirus.
Okay. Well, in Sierra Leone, most of the time when we have our aged, particularly those who are suffering from some of the disease that you're walking around, they mostly stay at home. How do you make provision for those who are at home suffering from some of those terminal diseases?
Well, that is where health promotion comes into play. If we're trying, we've got two main organizations in this country who are trying very hard in terms of cancer, raising their awareness, talking to people about it, signposting them to services that would help them. So we're hoping with that we'll reach as many people so people will not linger at home. However, there is a small level of outreach that is being done wherein people who have been discharged home, they are being visited and supported at home by the palliative care team that is based at Connaught Hospital. So there is a little work going on, but there is room for progress.
Okay. Well, the community outreach team should have to do more, because if you go, particularly from in the villages where you have so many aged people, they are suffering from some of these diseases and there is no one to give advice or to give them the appropriate support. So maybe as you progress in the community outreach thing, these are things you should be thinking about.
Absolutely. At the moment, to be honest with you, everything is still kind of concentrating on Freetown. And I personally agree with you. I think if we can reach out to the districts, the provinces, the villages, then we could probably ease the pressure on Freetown, because we can all see the population, the demand, and so on and so forth is so heavy on Freetown alone. And that's because wherever people are outside Freetown, they don't have the resources, or the resources are not available, so they have to come to Freetown. So my thing is, if we can reach out to them, maybe that would stop them from coming to Freetown unnecessarily. So yes, so it's early days, but that is all part of our vision, really.
Okay, back to the palliative care conversation. So, is there a difference between palliative care and end of life?
Well, end of life itself is pretty much part of palliative care. Palliative care, like I said earlier on, is quite a broad spectrum in the sense you're looking at making somebody comfortable during a time where they're either suffering with a life-threatening illness or life-limiting illness, or when they're actually at the end of life stage. So end of life itself is a stage that you get to when you've probably been palliative for a very long time. For example, if I give dementia, some people suffer from dementia for many years, and during that time they would be utilizing palliative care on and off, and then until it comes to the point where they're now actively dying, or the prognosis is quite near. That's when end of life kicks in.
So do you have plans, to train home caregivers?
At the moment, I don't have plans personally, but I think I hear a lot of rumors, a lot of talk going on, but I don't know how tangible it is. But I think there's so much going on. There's quite a lot of work going on behind the scene right now with the National Cancer Control Program for the country. So from there on, we will take it, step by step. But I think the key focus right now for me is if we're able to establish, a cancer environment where, for example, a cancer center or so on and so forth, where people know where to go, and then within that, which is you need a multidisciplinary team for it, and part of that multidisciplinary team is palliative care. Within that, you would then start looking at the different model of care and services, which would include community outreach and so on and so forth.
Okay, the other thing I want to ask you about, or maybe just hint you about, is in communities they have what they call community health workers. These are volunteers, not like particularly trained healthcare people, but they are volunteers who have been receiving crash trainings and who have been providing support, and they've been working in the area of
primary health
and all of that. So is there a way you can try to connect with those group of people? So because most of the time they call them when there are these episodes of dementia, or when somebody is suffering from a serious terminal disease.
Yes, I think that could be a way forward, because I agree they are the go-to person in lots of these local communities, and it's about educating them and giving them the basic. It's like giving them the first aid approach of the basics of what to do with palliative care and end-of-life care. But like I said, it's early days for me. I still have a full-time job. Some of these things need a lot of time. So, I'm kind of like in my baby phase, in my formative phase at the moment. So as I go along and welcome some of these suggestions and ideas, it kind of helps me to put into perspective what I really want to know in terms of projects and so on and so forth. Because part of my specialism is also education and training. I'm also trained to teach at master's level, so I do enjoy passing on knowledge and information. So yes, I will not hesitate. So I'm just looking at different ways, and for me, it's not just about just me doing it all. I'm very much willing and open and happy to welcome partnership as well. And if somebody else is already doing education and training and they just need me to do that aspect of it, I'm more than happy to do that.
Okay, so Isatta, do you have any message of hope for Sierra Leoneans?
Well, I would say to all Sierra Leoneans, we have to keep thinking positively. We have to try and do whatever little work we as an individual can to make a difference. And we have to learn to encourage others who are trying to make a difference and embrace them and welcome them. And let's hope for a brighter future.
Thank you very much, Isatta, and it's a pleasure having you with me today. And so, viewers, if this is your first time tuning in to Chat with Nene Alice, don't forget to subscribe, don't forget to like, and don't forget to send in your comments. It's been a pleasure talking with Isatta Sisay-Jalloh, and we'll hear more about her as she progresses in the things that she's doing in Sierra Leone. And also, don't forget to root for Sierra Leone at the African Cup of Nations. Thank you very much, and I wish you a blessed and prosperous 2022. Thank you.